Novelty Health Shine.
Hello, hi, I'm Dr. Rishikesh Pai, a gynecologist and infertility specialist. I am practicing IVF for the last 30 years in 1990. In 1989, I went to Melbourne, Australia, where I did my fellowship in IVF, and then I came back in 1990 and started IVF in 1991. My first IVF baby was born in 1993, and in 1995, along with my colleague Dr. Nandita Balshendar, I started the Bloom IVF group, which has now presently 7 IVF centers all over the country, including 4 centers in Mumbai and Navi Mumbai, and in Delhi, Gurgaon, Mohali and Faridabad. I'm very happy to wish you all today. It's a very auspicious day, 25th of July, which is called the World IVF Day. On this particular day, in many years back in 1978, Louis Brown, world's first IVF baby, was born in London, UK. And since then, nearly 4 to 8 million, exact figure we don't know, but nearly 8 million IVF babies have been born all over the world. In India, the first IVF baby was born in 1984, baby Harsha. And it was a time when I was in KEM hospital as a registrar. And that really inspired me, and it helped me to choose my line. After I did my gynecology, it helped me to choose my line, and I went to Australia in 1989 to learn IVF. Since then, it has been a fantastic journey. I have helped so many thousands and thousands of people achieve pregnancy, and during this journey, a lot of new technologies came in. I went every time abroad, and one of the pioneers in bringing so many new technologies into the field of IVF. I remember in 1998, I brought assisted laser hatching technology into India for the first time. And then a lot of technologies like IMSI technology. In 2007, I did the first egg freezing in the country. I did the first vitrification of embryos in 2007. And then we went on evolving. We bought the first embryoscope in the Asian region in 2012. And we also started doing ovarian tissue freezing for patients having cancer. Before they go for cancer treatment, we can freeze their ovarian tissue or their oocyte, and later on they can do the treatment. And after that treatment, when the ovaries are damaged, we can use those frozen oocytes or ovarian tissue to get pregnancy. So a lot of new breakthrough technologies we introduced. Recently, we have introduced newer technologies like in patients with male factor infertility, where there is a low count. We have a new technique of microfluidics, which we can use filtration system to harvest good quality sperm. Another new technology we have introduced is called IMSI technology, where we can actually magnify the sperm 6,000 times and select a better quality sperm and use it for micro injection. Another technology is the artificial intelligence. During the COVID time, we have introduced 2-3 very good new technologies. Like one is the AI technology. So now, if there's an IVF cycle, a lot of embryos are formed, but you have to select the best embryo. You can't put all embryos into the patient. So with the artificial intelligence, we can take photographs of the embryos, the blastocyst, and the computer tells us which is the best embryo to put back inside, which will give the best chance of pregnancy. So instead of putting 2-3 embryos back, you can put a single embryo back and still get a very good chance of pregnancy. And what happens with this technology? We can reduce the incidence of multiple pregnancy, because twins, triplets, if you have, there is a more complications during pregnancy. So if you can achieve the same pregnancy rate by putting single embryo back rather than putting 2 or 3, that will give a breakthrough in the technology. We also do what is known as egg freezing. So what is egg freezing? Why is it done? So a lot of women are there who don't want to get married very soon, before the age of 35. So if they are young patients who don't want to get married, they can freeze their egg. For next 5 to 10 years, we can freeze these eggs. And when they want to get married at the age of 40, they can use the frozen eggs which they had frozen at the age of 30 and get good quality embryos and get good chance of pregnancy. So all these new technologies have evolved over the last 30 years of my practice, and it is still a very exciting line. A lot of new things are coming in the future. One of the big things that I introduced 2 years back was the genetic technology. So what we could do now, we have a new technique called next gen sequencing technology. So with this technology, when the embryo is formed and it becomes a blastocyst, before we put the embryo back in, we can do an analysis. We can do a biopsy of the embryo, analyze it, whether it has got genetic problem or not, and put only the normal embryo back and get a very high chance of pregnancy. This technology especially is very good for women who have older women, more than 35 years of age, or in women where there are repeated IVF failures, 2-3 failures, they have not become pregnant despite of doing 2-3 IVF attempts, or in women who have had repeated abortions or miscarriages. So in these patients, we can actually do a biopsy of the embryo. It's known as pre-implantation genetic testing, and we can analyze it with the latest DNA technology, which is also used for sequencing the COVID virus, and that is known as the next gen sequencing, NGS technology, which we have in our unit. Not only that, this NGS technology now can be used for analyzing the embryo without even taking a biopsy of the embryo. So the DNA of the embryo leaks out into the surrounding culture droplet. We can now take that DNA, we can amplify that DNA using a technology called Malpac, and then analyze that DNA with the NGS technology, and then tell whether this embryo is genetically good or genetically bad. And so we can now predict good genes in the embryo by not even touching the embryo. So it's a non-invasive technology. So huge amount of breakthrough work is coming in the field of IVF, and I'm very excited. It's been a fantastic journey. All these things that I saw right from my student days in KEM hospital, and then we went to Australia, then all over the world, all throughout the journey of last 30 years, we're going abroad, picking up new technology, bringing it here, applying it here, getting the excitement of getting this, to use this technology to achieve pregnancies in people. It's a fantastic journey. Not only that, I also feel that in our country is full of poor people. So there are two types of India. One India is a 200 million people India, which is a well-off India. But there's another India also, which is 1.1 billion people India. That is the India also we have to take care of. And the challenge of IVF is to see that not only these 1.1 billion people, they also have access to this IVF technology. The challenge is not in giving them access to the technology and giving them poor quality. The challenge is to give them the same quality, the same care as you would give a well-off patient. This is the challenge of the future, and I believe that our government, with the introduction of Ayushman Bharat, our government has done a fantastic thing. A lot of poor people can access now good quality Medicare, and I would like to request our government, our Prime Minister, to also bring IVF under Ayushman Bharat, because recently WHO has announced that IVF is a disease. It's like any other problem, and this problem also needs to be solved. Not only that it is a disease, but it's a social problem also. It's not only a physical problem, but it's a social problem also, and that is why I request the government to bring IVF not only under Ayushman Bharat but also under insurance scheme. So on this auspicious day of the World IVF Day, on the 25th of July, when many years back the first IVF baby Louis Braun was born, I would wish you the very best, and I would like to request the powers that be in our country to think about all the poor people and bring the IVF under Ayushman Bharat. Wish you the very best.
If you know of any couple who are unable to conceive within 12 months of trying, please encourage them to seek help from medical experts. Let the reach of scientific advances in reproductive health spread to all corners of the country and bring joy to all such couples. This public awareness message aimed at spreading awareness on infertility and its treatment is brought to you by Novelty Health Shine.